Good evening, everyone. My name is Bob Magnus, the mayor of the city of Oconomowoc, and we're excited to have this informational session for our community. Good evening, and thank you for joining us because our topic of discussion is the upcoming fire staff referendum that is scheduled for Tuesday, August 9th. As many of you are aware, this issue has been in the news in our community and also in others, and across the state here in Wisconsin. There are a lot of changes that are going to be brought and shown to you by our Chief Bowen, but it still comes back to the point that when you call 911, you want to make sure that the police arrive. When you call 911, you want to make sure an ambulance is there. You want to make sure that if you have a fire, you have as quick a response as possible. But unfortunately, that doesn't always happen. So our fire district, a few months ago, the Western Lakes Fire District worked with city officials. They worked with multiple municipalities in this co-op group and also with the fire board to try to look for solutions to some of our labor issues facing the fire department. They've identified those issues and they've looked at solutions, and as a result of their work, along with a community survey that was sent out to all residents in the city of Oconomowoc, we do realize that we have very limited solutions, and that's why we are in this position we're in today. So what we'd like to do is, it brings us here tonight, is to learn more about why this referendum is coming to you. This is an informational session, and make sure that you as informed citizens really understand how you want to vote, where you want to vote, based on the facts and the information that's presented. So Chief Bowen, next to my left here, will be going forward with a little presentation to start out this evening, and then we'll be available for questions and answers right after that. Now, if you notice when you walked in, you had these little cards back here. If you'd like to make a public comment, our goal is to have you come up to the podium and make that public comment and questions, and we'll do our best to get you the answers that you need. So if you could please fill these out, that would help us a great deal. I'd also like to thank all the council members who are able to come this evening, and they're also available to ask questions too if you'd like. I'd also like to introduce one of our board members, Charlie Shaw, who is also here and available to help you in any manner. We're going to try to be as orderly as possible as we move forward through this, but again, this is for you. This is to try to get the information, answer your questions, and make sure that you have all of the facts. Chief Bowen.
Thank you, Mr. Mayor. I just want to start off by thanking all of you for taking time out of your evening to come and gather information, ask your questions. That's the whole purpose of today's meeting. I'm going to run through a PowerPoint of various materials, and at the end of that, we'll open it up for questions and answers. We've got Charlie Shaw from the Fire Board, as well as the Common Council here tonight to help us answer those questions. Just a little bit about me. I started as a volunteer firefighter myself. My grandmother and my grandfather were volunteer firefighters up by Holy Hill in Richfield. My mom and uncle also were volunteers, and having grown up literally in the back of an ambulance, because my grandma would run the ambulance during the day while my mom worked, I was in a car seat while that happened. The times have changed, obviously, since I've grown up. And that's the challenge that we're up against today, is keeping up with the changes of society. So we'll go through a lot of that here tonight, and then again, open it up for questions. So Western Lakes Fire District, we serve a total of 11 different communities in 3 counties. We provide fire and EMS services to 7 municipalities in Waukesha County. Those 7 municipalities are the City of Oconomowoc, Town of Oconomowoc, Town of Merton, Town of Ottawa, Village of Dousman, Village of Lac La Belle, and the Village of Summit. We also provide contracted EMS services to Jefferson County in the Town of Concord, Town of Sullivan, and the Village of Sullivan. They have their own fire departments, but we provide their emergency medical services with ambulances. The same goes with the Town of Ashippun in Dodge County. In total, that we serve 54,500 residents between those 11 municipalities. We're blessed to have a very diverse community, a high quality of life, and a very attractive community to live in. We've got 2 hospitals right here in the fire district, Pro Healthcare Oconomowoc and Aurora Advocate in Summit. We've got I-94 that takes us to Madison, to Milwaukee. We're basically right in between 2 of the largest metropolitan cities in the state of Wisconsin, within 45 minutes. We have 3 behavioral health and mental health complexes, 27 different educational facilities, 11 senior retirement or nursing homes. We've got retail, we've got commercial, we've got development. But one great thing that we have that not everybody else has is our recreational and our outdoor activities. We've got lakes, we've got rivers, we've got forests, we've got farmland, and we've got urban growth as well. In total, we serve 215 square miles. So the district covers the 215 square miles between those 3 counties and those 11 municipalities. One thing that gets brought up frequently is, what have the consolidations done for our communities? We're talking about an increase in taxes for staffing. What has the consolidations done as a benefit? One of the biggest reasons of the consolidation was sharing of resources, sharing of staff, but eliminating duplicated resources. Prior to the consolidations, we had 3 different ladder trucks, and we were able to decrease that to 2 ladder trucks, one on the north side, one on the south side. Replacement ladder goes from anywhere between $1 million and $1.4 million. So we were able to reduce our capital spending by $8 million every 20 years, not taking into account inflation. There's many other efficiencies that we've found, and that's the buying power of the district. When we go to bid for new SCBAs, the breathing apparatus that our firefighters wear, or a new ambulance, instead of buying 20 SCBAs, we're buying 75. So we're getting a better price with that buying power, as well as vehicles and equipment. We were able to look at efficiencies with ambulances after their service life, taking the box of the ambulance off and putting it on a new chassis after they have 150 or 200,000 miles and are 10 plus years old. And that reduces the cost of a replacement ambulance by up to 40%. So those are some of the positives that we've had. One of the other is we brought paramedics to our communities. Prior to the consolidations, we didn't have paramedics on our ambulances or available. We had to call from another fire department to bring paramedics to us. That was done as part of the consolidations. So our community is growing. Our population has increased over the last 10 years by 7%. In addition to a growing community, because the growth is not the only reason that we're in a staffing shortage. We're an aging population. Waukesha County and our communities are one of the fastest aging counties in the state of Wisconsin. So that's added to the reduction in the number of bodies that are willing to and able to volunteer as firefighters and EMTs. This is an overview of our district. You've got the 6 different fire stations. The 6 stations were all in place prior to the consolidations and have remained in service since the consolidations. They're strategically placed throughout the district. Again, we cover 215 square miles. And we've got a station at Paps Farms. We've got a station in downtown Oconomowoc. We have a station in Okauchee, a station in Stone Bank, a station in Dowisman, and an EMS-only station out in Sullivan. Those 6 stations are the stations that provide services to our communities. In total today, we have 24 full-time positions. 23 of those 24 are sworn positions, which means 23 of those 24 are working individuals out on the streets. One is an office human resources director. We additionally have 138 part-time or paid-on-call firefighters and EMTs. Of that 138, only about half of them live in our communities today. And I'll touch on that a little bit later with regards to the decline in volunteerism locally and throughout the state of Wisconsin. But half of that 138 are employees that are traveling from Waukesha, Madison, Milwaukee. We even have some that have primary residence all the way down to Racine, Kenosha, Wausau that come here to work part-time for the district. And then one other program that we started to help with the staffing and to bring new firefighters and EMTs into our communities in a cost-effective manner is the Internship Program. We started this in 2016. The interns are firefighters and EMTs, they're entry level, and over a 3-year period, they go to school for paramedicine and their associate's degree in fire science. They live at the stations almost as if it's a college dormitory. That program saves us, as compared to 15 full-time employees, $1 million annually. And they help us with about 56 hours of coverage every week per person. They work the same rotating shift that our full-time firefighter paramedics work, of 24 hours on, 48 hours off, which comes out to a 56-hour work week. One of the challenges that we've got is staffing. Right now today, we have people at the fire stations. All 6 stations have people at the fire stations. Not everybody is licensed as a firefighter. Some people are not engaged in being a firefighter. Some people don't like the EMS side of it. So when we're talking about our part-timers or our paid on call, our volunteers, we're blessed to have them serving our communities in whatever capacity they're comfortable in, whether it's EMS or fire or both. A majority of our staff do eventually obtain both certifications, but our in-house staffing today allows the ambulances to respond. After that, anything that requires a fire truck or a car accident, a gas leak, a cardiac arrest, somebody that's unresponsive, we call both the on-duty station as well as our paid-on-calls off-duty personnel to respond to the station to bring additional personnel to that scene. It's anywhere from 3 to 4 people in-house at each station today. And with currently our wages, we're right now hovering right around 2 to 3 people per day. So locally, we've been seeing a decline for the last 2 decades with regards to resident paid-on-calls, volunteers. We went back to 2001 to look at how many residents were serving the various fire departments back in 2001 as volunteers or paid-on-calls. That number has steadily been declining the last 2 decades, to the point that today we've got under 70 local residents serving as volunteers or paid-on-calls. And why is that? There's a number of reasons. There's no one reason. A large component of that is society has changed. I was not here at the time, but talking to some members that have served for 40 years or 30 years, back in the 1990s, there used to be waiting lists to be a volunteer firefighter here in our communities locally. Those waiting lists kind of went away in the early 2000s. So if you wanted to volunteer, you could just go in, go to fire school, go to EMT school. Come the late 2000s, 2010, we started to send flyers out, advertise, volunteers needed, we'll send you to school. That number has continued to further decline with regards to wages and home life balance. Carnation Foods here in the community used to employ almost a whole shift of firefighters that when the fire tones would go off, they could leave and respond to the fire station with a fire truck. Many businesses can't afford to lose employees randomly throughout the day for an unknown period of time. Gas stations, convenience stores, farmers, that modality is not always there like it used to be. Also, with the home prices in our community, many times the volunteers that we have are fortunate to live where they're living, but new volunteers coming in might live further away, which is where we're seeing a delay waiting for off-duty personnel to come into the station of between 5 and 7 minutes before that truck can roll. Calls for service have increased. We saw ups and downs during COVID, but if we went back historically the last 10 years, we've been seeing call volume increase at a rate of 10 to 12% annually for the last 10 years. Our current response times for a fire engine or a ladder truck to get on the scene is 11 minutes and 14 seconds. That does not meet the national standards for an urban area of having a fire truck on scene in 6 minutes. And in the more rural areas, having a truck on scene in 10 minutes. We follow NFPA 1710 and 1720 because we're a mixture of urban and rural communities, so there's different standards with regards to response times. Our fundamental challenge, this challenge has been being discussed for years. Actually, I know the prior fire chief put together a proposal for additional staff that came to $1.5 million per station back in 2015. The fundamental challenge that we have, as well as the community, is limitations with regards to tax levy increases that are imposed by the state of Wisconsin. As a result, we have not been able to keep up with the decline in our volunteer and paid-on-call workforce, the increasing wages for part-time and full-time employees, and to keep pace with the growing demands of our services. As call volume continues to go up and staffing continues to go down, the current staff continue to get more burnt out. This is not local just to us. Last fall, the Wisconsin Policy Forum, and if anybody's heard of the Wisconsin Policy Forum, they're a nonpartisan agency. They used to be called the Wisconsin Taxpayer Alliance that looks into how municipalities are using the dollars of their residents. They put together a white paper for the League of Wisconsin Municipalities with regards to, is the state of Wisconsin in need of resuscitation of their fire and EMS services? And are we in jeopardy of a collapsing system? Other communities have already addressed this issue through referendum and other means. Fond du Lac, most recently this April, Fort Atkinson. In April, there were 8 referendums in the state of Wisconsin. So our communities, as I mentioned, we've been talking about this for the last 5 budget cycles. We knew the consolidations were going to help with the controlled spending of capital improvements. However, we knew that the labor side would have to be addressed at some point. Every year, we would work and discuss what can be done. However, but due to the limitations of the levy limits, we couldn't make a big impact on the labor side. We've made changes. We've been able to get us to this point. We put together a task force. That task force included representation from the fire board, the fire district, and each of the municipalities represented, from elected officials to finance directors to administrators, worked through data, worked through standards, worked through comparables to put together a proposal, which was the options assessment that was presented in March of this year. The task force looked at 3 different models. The do nothing, stay the course of where we're at today. However, that model was determined to be unsustainable as we've continued to see an increase in call volume and a decline in current staffing. We looked at what does it cost for a full career model. That cost came to about $10.5 million. Looked at the hybrid model. What are the gaps? What are the current gaps that we have, and how much would it cost to fill those gaps? So we looked at comparable wages for our part-time and our full-time staff, our paid on calls, our interns. We looked at how many people do we need to ensure that the fire truck goes out the door when somebody calls 911 without eliminating or removing our part-time or paid on call or our current full-time staff. What is the gap necessary to fulfill that? And that's how we came with the proposal at $6.3 million. The other key component of that was sustainability. We don't want to come back and say it's broken again. We looked at numbers at $3 million. And through looking at increase in budget, we would be back for another referendum in 3 to 5 years. And that was not palatable with the group. We also didn't have the ability to phase in the referendum due to it being for labor and for staffing costs. And that's how the $6.3 million came to be. What will that get us? So the referendum includes 33 full-time firefighter paramedics. That will be split between 3 shifts. So 11 more people a day spread out between the 5 stations that do fire and EMS response. The 3 battalion chiefs are the shift supervisors. They're the incident commanders of large-scale incidents. They're the safety officers. They're the ones managing the day-to-day operations in the field with the crew. 1 full-time administrative assistant and 1 fire inspector. That provides us that 5-person crew so we can roll the ambulance with 2 people and a fire truck with 3. Those 5 personnel are the effective response force from 1 station. If there's a working fire, that's not 1 station. That's at least 3 stations, if not all 5. Currently today, it could take us more than 20 minutes to get an effective response force on scene. With this model, we'll be able to have an effective response force in the urban areas that meet NFPA 1710 and in the rural areas 1720. In addition, it's not just about firefighting. We go to gas leaks. When we have to go to a gas leak and evacuate a business and shut off the gas line, there's a lot of personnel required to do all of those tasks simultaneously. Water rescues, car accidents, extrications, and even our everyday medical emergencies where we've got to do CPR, airway, breathing, IVs, medications, get past history. That's a very personnel and labor intensive response. This will allow us to do that and also reduce our response times because we won't have to wait and have that pause for that initial response. In comparison, we looked here locally at what other businesses are paying their part-time employees. And compared to Aldi, Taco Bell, Fleet Farm, Metro Market, Kroger, our part-time employees are averaging $14 an hour. This will allow us to bring our part-time wages up into a competitive market with our private and public sector comparables that we're losing staff with today. Our current budget, 80% of it goes towards personnel costs, which is fairly common with fire and EMS services. We're not spending a lot of money on all the extras. It's the labor, which we're a very labor-intensive resource. We bring in $2.4 million a year of revenue from insurance payments. One important piece of that is that includes Medicare and Medicaid. Currently today, our payer mix, which is the different insurances that pay into that budget, 62% of that is Medicare. Another 5%, I believe, is Medicaid. Those two have fixed payment requirements where they will only pay X amount, and then that's what you're getting. We, in turn, have to write off $3 million a year from the Medicare and the Medicaid payments. Looking at other municipalities, from the Wisconsin Taxpayer Alliance, the 2019 data was their most recent data available that has been looked at. And we looked at various departments and communities on what the amount is per resident on the taxes. We looked at municipalities like the City of Pewaukee, City of Waukesha, the North Shore Fire Department, which is a combination department, which has 7 municipalities as well. And we'll go through North Shore a little bit more in detail later. Village of Johnson Creek, Village of Pewaukee, the statewide average. And what the referendum will do if it's passed, it's gonna move the Western Lakes Fire District's cost per resident to the statewide average. Right below the statewide average is where we will fall moving forward. Village of Menominee Falls, New Berlin, the City of Elkhorn is on here. They did a referendum in 2020, so that number has not been shifted to include their new referendum numbers. Village of Sussex, the Village of McGuanago, who has passed a resolution to go to referendum in November of this year. Village of McGuanago, or Village of McFarland, City of Watertown, and Village of Heartland for comparables. So I talked about the North Shore Fire Department. North Shore Fire Department serves 7 municipalities for fire and EMS services. They're a consolidated fire department in Milwaukee County. They were established more than 2 decades ago, and they've been the foundation of many consolidation agreements. Our agreement follows them very closely. Their population is bigger than ours at 65,000 compared to the 54.5. Their square miles covered is 25 compared to our 215. So they're very densely populated with their stations. Their current 2022 spending per resident was $204.48. Our current spending for 2022 was $70.95. If the referendum were to be approved, the 2023 fire spending is $208.57 for North Shore, and ours would be $172.72. And as I stated, the statewide average, if we applied a 2%, would move the statewide average to about $178 per resident. This is a breakdown, and this has been in the various informational flyers, and all of this information is available on our website as well. This is a breakdown of both the wages and the benefits. So this includes Medicare, Social Security, health insurance, life insurance. These are the full costs of those positions. We utilize a funding formula to determine the amount that each municipality pays. That funding formula is based off of call volume, so how many calls a year is fire and EMS needed in each community. We utilize population, improvement value, so the physical assessed value of tangible property, and then lastly, land value. We separate the land and the improvement value because there's a bigger response and a bigger service of fire and EMS to physical property versus land. But we do respond to the lakes, we respond to field fires, we respond to rural areas as well where the land value does have a component. Some municipalities combine the two of them together, which that did not work for our municipalities due to the number of lakes in our communities. So that formula is a 3-year average. And with that comes the percentage that each municipality pays towards the fire district's budget. We put together the options assessment in March of this year, followed by a community survey that was sent out at the beginning of April. The two most feasible or universal options was implementation of a wheel tax or proceeding with a referendum to increase taxes. This was the breakdown if a wheel tax were to be imposed, and this was based on the number of registered vehicles in each of the municipalities. This does not include registered vehicles for many of the corporate and businesses, as many of them have their vehicles registered in other states. From there, we looked at the cost on the property taxes, and these amounts were based on the 2022 assessments, as the 2023 assessments were not available at the time that we put together the options assessment. So $100,000 was used, as it's easy to multiply and it's easy to spread that out. We broke it out by month as well for residents that escrow their taxes to see what that monthly impact would be if they multiplied it times the value of their house. The community feedback came back with 93% of residents believe that high-quality emergency services is important to them. 62% of the respondents believe that a referendum was the appropriate route to proceed to address the funding and the staffing needs of the district, where 21% of the respondents believed that the wheel tax was the appropriate route to proceed with. The ask on August 9th will be if voters approve a tax increase for fire and EMS staffing costs beginning on their 2023 tax bills. And with that, I will open it up to questions or comments.
If you have a question, we have one person that's filled out a card, and we'll just read your name. Chief will read your name. You can come right up to the podium. That way we can all hear you, and we're also taping this, so if other people want to listen to the evening, they can do it on their free time. Go ahead.
She's coming up.
Hi, my name is Molly, and I live in Dousman. So, a couple questions. The Dousman cost per person is significantly higher than everybody else's. Why is that not divided equally so that no one community is overly burdened with that? And then two, when I look at, we have basically 2,000 residents, that's only 3.7% of the service, the population that you're serving, but yet we're taxed with 5.9%. So, questions there.
Sure. Let me stay up there so I can get them both for you.
Okay.
So the funding formula, going back to the funding formula, the heaviest weight is call volume. So that's 50% of the total funding formula. So we look at how many fire and EMS calls occur in each of the community over a 3-year average. And one of the components in Dousman is there's one very large, proportionately community center. And that goes into the total call volume. And many of the other communities also have them. And we work with the municipalities on what's called payments in lieu of taxes. And if Lori or the city wants to talk more about the cities, but with regards to Dousman, that is one thing that we're working on as the fire district with the village board, is to improve that payment in lieu of taxes to help offset that cost to the taxpayers.
Okay, you
from
said you had
nonprofits.
11 of those community, or those centers. We have one, but yet I don't see any of the other communities having that large of a tax burden per resident or per home.
It's truly based on the number of calls for that one and the size of that one proportionally compared to some of those others.
So then, as a business question, when do you start getting to where you, and I know there's a phrase for it, and I'm nervous, so I can't think of what it is, like an economy is of scale. If you're making additional calls, at what point do you start having an economy of scale where you're starting to actually fund what you're doing? I mean, it sounds like what you're saying is that you're having all these extra calls, but there was no economy of scale, and even though we're billing, we're not making money, we're losing it. Am I hearing that correctly?
Yeah, a big component of that with the EMS world, as well as healthcare in general, is the Medicare and Medicaid payments. When we've got over 62% of our payments that have mandatory write-downs by Medicare and Medicaid, that doesn't help that economy of scale. If Medicare and Medicaid adjustments, and that's one thing that we have worked and continue to work with the state on and the federal government to try to improve those payments, is that would help. However, there's been no movement on the federal level to improve the Medicare reimbursement rates. The Medicaid reimbursement rates have been approved to help fill that gap. And that's already been taken into account as that was approved as part of the budget process moving forward for Medicaid, but that's the smallest component of our payer mix.
And were there additional COVID funds, given the last 2 years? There was so much money flooded into our state for that. Were there additional COVID funds that should have helped with so many of those calls?
So the additional COVID funds that we received were targeted towards PPE, equipment, disinfection. Governor Evers just approved a grant, which is the Ems Flex Grant, and that's for equipment costs. So it's up to $200,000 that a department can apply for equipment. However, it's broken down into different categories, where some categories you can only apply for $30,000, you can apply for $15,000. So we have applied for all of those grants. One other grant, since you brought up other potential funding, is we applied for the what's called SAFER grant. It's a federal grant that helps with staffing. However, one of the things when you accept the grant you have to acknowledge is you've got the funding to retain that staffing afterwards. And that grant is a short-term, it's a trickled, phased out grant over 3 years. So before we could accept that grant, if we get that grant, we have to know that we've got the funding moving forward to retain these personnel. And that's one of the challenges that we have with the current budgets and the levy limits.
Okay. I still am not quite sure why Dousman has to pay more than other community members, but.
And if you want, because it's Dousman specific, I got my card up there, and we can talk with the village president and hopefully explain that one a little bit more.
Yeah, and
So what he said is there's two components to the payment. It's residents, but also call volume. So because of the size of 3 pillars, as a percentage of your overall community, it's much larger than our 3 or 4 facilities here in Oconomowoc. So because there's more calls there, you have a higher call volume, and that's a portion of that rate. So if it was just by residents, you'd only be, what is it, 3.6%, but because your call volume's higher because of that other facility, you're up to that 5.6.
okay, but those employees or the staffing is going to be the same whether we have 1 call or 100 calls. So I guess that's the economy of scale I'm talking about is, yes, we have more, but we have a station right there. They're already there staffing.
So the way the funding formula worked is when the original 3 or 4 districts got together, that's the funding formula they agreed on that they thought was fair. So some areas that have less people but maybe more calls versus areas that have more people but less calls. So that's how they agreed on that funding formula years ago. I think Western Lake started 8 years ago, 10 years ago. The city joined 5 years ago,
Yep.
and that's what we all agreed to as part of the deal. And I think that's always been relatively fair.
Unless you're living in Dousman and you're paying twice as much as somebody
But you're
in
getting,
Oconomowoc.
but because you have more calls. So you're saying that you shouldn't have to pay for the service. And what the formula says is you're paying for not only your residents, but also the amount of services coming as well.
But this is for staffing. That's not going to be solely in Dousman. This is for the whole Lakes region.
Yep.
So that's my question is why isn't the whole Lakes equally absorbing the staffing that the whole Lakes region is going to enjoy?
Yeah, I mean, the city, I mean, and this is the hearing session mostly for the city, but we're, I think, eating almost 2.4 million of this new cost. So we're eating about 36%. So we're the biggest player by far, and we have the biggest number to make up for per, overall numbers.
And
It's not a perfect explanation, but because we need the staffing increases, we're paying the staffing increases like we have paid everything for Western Lakes all along based on the funding formula.
And I can jump into, when you talk about economies of scale work really well when you have like businesses that you can consolidate to move forward. What we have to realize is the business model for the fire department's changing because we can't find labor, and labor is 80% of our cost. That's a big driving force of the whole thing. And a lot of people get frustrated. You say, geez, y'all consolidate and aggregate, should cost us less, right? And eventually it will once the new model is in place, but we're going through a very uncomfortable transition with this referendum that we all wish was not there, but we also want to have a safe community. So hopefully that helps a little bit. Chief?
Sure, and I was just going to touch, and I hear what you're saying, and that's where I'm thinking it might be easier to put some pen to paper on it. One of the big economy differences is different communities negotiate these pilots differently. And every community gets a different amount from their various nonprofits. And that's up to the various elected bodies to work with those nonprofits to help offset the payment in lieu of taxes for nonprofits that don't have to pay taxes, but are still receiving those services. And that's where each community board does this differently and gets a different payment to help reduce the impact for taxpayers, because they're getting that revenue still from their nonprofits. If that makes sense.
So that's a big part of it. The other big part of it is where that call volume is received, right? So if that's received at a Shore Haven or a Three Pillars, the chances of the Medicare being part of that payer mix is greatly increased. Medicare requires a 65% write-off. So from an economies of scale, if you're losing $1 every time you do something and you do 100 of those, you're losing $100, right? So it's $3 million worth of write-off last year between Medicare and Medicaid. The ask for what we're going into is $6.3 million to provide adequate staffing, which, if you take into consideration that write-off, is half of what's being asked for because of the way compensation is provided for those services, specifically in those heavy demand areas in senior living.
And I understand the need. I'm truly not debating that. I just think that being a resident of the one where it's the hardest hit for that burden, I think that there may be a more equitable way to divide that amongst everybody being served.
Noted.
You need to share that with your fire board members so that they're aware of that.
At this point, it's a done deal. I mean, the vote is in August, so my
It is.
comments probably mean nothing at this point.
So, the referendum question is the referendum question. However, that's something that all of the elected boards, including the Village of Dousman Board, we meet 3 times a year to discuss budget on operations and agreements and formulas. And that is noted, but also the payment in lieu of taxes is a big driving force, and that was discussed at the Village of Dousman's meeting 2 weeks ago for the residents that had the same concerns as you. And we're meeting with Three Pillars to discuss that to help offset that moving forward.
Our services do help support the entire.
Yep.
Yeah, we're taking a huge
That's true.
Yep. Nope, I made that note and I saw you grab my card, so please reach out and I'll get you connected with your board too. Thank you. All right, I got one card. If anybody else has cards, if you just want to bring them up to the corner there, or one of my guys can grab them.
While you're grabbing the cards, to kind of help her with her question, was the meeting in Dousman recorded?
No,
Oh, it wasn't?
they did not have the ability to, with IT. Karen, I know you had one question. Did I get that?
Well, no, you kind of answered part of it, but you had said prior that there was some communication between the village and Three Pillars to potentially up their pilot. And you addressed some of that, but is there any indication that there's likely some resolution there?
So yes, Three Pillars did express that they want to work together, and we can't make any promises until we know the yes or no of the referendum and then also the pilot. But that's a key part of the referendum question for any of the communities is it's an up to amount. The municipalities don't have to go with that full amount if they end up with other funding, that they don't have to go with that full amount. All right, I've got Ed Ernster.
Actually, I kind of wanted to speak to everybody over here, but hi, my name is Ed Ernster. I've lived in Oconomowoc with my wife Mary and daughters Isabella and Madeline for 19 years. Our family is always looking to save money. I don't normally vote for higher taxes. In this case, I'm strongly in support of providing the fire department the funding they needed for the safety of our community. Here's why. My 19-year-old daughter Isabella makes $15 an hour and another 3 in tips working at the Wisconsin Brewing Company Park where the dock hounds play. My 18-year-old daughter Madeline makes $17 an hour working at Buddy's poolside. Neither had any previous training or certification. Neither is pledged to putting their own lives at risk carrying out their jobs. They may experience a rude customer, but in all likelihood, neither will come upon a scene that will cause them to suffer for PTSD for the rest of their lives. It doesn't make sense that we are paying the majority of the fire department staff less than my teenage daughters. In our house, health and education are the priorities. Safety is, to me, very close to health. Let's consider if Isabella had a serious health issue. Would I want to propose to my family that we would take Isabella to the lowest cost healthcare provider in the region for treatment? Of course not. It doesn't make sense. But that's how our community funds safety. In business, the labor market is really tight right now, as well as everywhere. Attracting and retaining talent is the focus of every business. We are not able to retain the talent that needed for $14 an hour. We're able to hire them, train them, and then they go elsewhere for better wages. The cycle results in our fire department having the least experienced staff of any in our area. If your loved one is in an accident, do you want the first responders to be the least experienced? Of course not. It doesn't make sense. What does make sense? Funding the Western Lake Fire District at an average level relative to other communities. Thank you for listening.
Thank you. Richard Penlesky. Thank you.
Hi, I'm Richard Penlesky. I agree with everything that Ed just said, and I support the concept of the 6.3 million. I am from Dousman, and I actually attended the meeting in Dousman, learned a lot there, but then had follow-on questions. The crucial question for me was how the referendum would pass, whether it would be a majority of the votes across all the municipalities, if that would carry the day, or if each individual municipality had to approve it separately. That's my first of a number of questions.
Yep, I see you got 3. So the first one is each municipality has their own referendum question. So each municipality's referendum question would need to be approved as a majority vote of those that vote for that question, either yes or no. So each one has to do it individually. I see that if you want me to just roll to the next.
Go right ahead to number 2.
The number 2 is, what happens if one or some don't approve? And that's a discussion that the various boards have had and the chief electeds have had. And the group, and Mayor, you were with those meetings, said after doing the options assessment and the survey and the homework of the task force, moving forward together was the best route initially with regards to the referendum. If one municipality were not to approve it or have other considerations, that would be something that the various communities would have to talk about after August 9th of, do they impose a wheel tax? Do they transition to borrowing? Do they look at a fire protection service fee? Or what are the other options? But that's really what the options assessment looked at, were those primary options.
So if one municipality does not approve, then all the municipalities must come back together and reformulate the entire plan? Or does the burden fall upon that one community to reformulate a plan to meet its share?
Yes, so when I said the municipalities will talk through it together is that spirit of cooperation between the municipalities, but that municipality or those that were not to approve it would have to figure out how to fund and staff their resources moving forward.
Whereas the others would go forward and be funded using the 100K per assessed value for homes.
Correct.
Okay. The third question is just me expressing my own angst, being from Dousman. I'm in support of the concept, but I'm seriously against the inequitable allocation of the way things are funded. And I understand that it's, because of our unique makeup, this is water over the dam, but I wish that when the proposal was formulated, someone had really looked at the severe deviation that Dousman is relative to the rest and formulated a plan that appeared to be more equitable. It would have made it easy for me to vote. As it is, I'm at my second meeting already. I've spent a lot of time talking to neighbors, and it's become a very difficult task, whatever, for me.
And I thank you for that. And I know that the Dousman board is not here tonight, but you were at the meeting.
Right.
They encouraged you, any Dousman residents, to come to their budget process because that was one of the conversations that they've had with their nonprofits of the disproportionation, where if they were getting some pilots the size of some of the other communities, that could help bring that number down.
I hope so. Thank you.
Thank you. I've got Jeff Mill. Yes.
My name is Jeff Millings. I've been a resident for about 6 or 7 years. I initially didn't like this proposal much at all. Now that I see it, it makes a lot more sense. My biggest issue is that the costs are static, but the community is growing. We're going to have hundreds of millions of dollars of new properties brought online over the next 5 to 10 years. So as property grow, isn't that dollar amount going to grow as well? And as communities grow differently, will it get rebalanced, reassessed over time? And then also, how does this sunset? Is this in perpetuity? Is this reevaluated at a certain point? What's the long-term plan?
You got that one? No?
You would like me to?
Why don't you go for it first?
Okay. So many parts to that question.
Sorry, yeah.
That's okay. So, yes, the referendum is in perpetuity for
Okay.
the amount that is here right now. And you're right, as the city grows, as there's more tax base, right, there's more people paying that tax. Generally, what happens with that is that helps maintain the tax level
Okay.
for the individual people, because there's more people paying that amount.
Right.
But as it goes up, you also have to understand that every year costs go up a little bit too, so it
Okay.
helps us manage that and
Right.
stabilize that somewhat. And then what was the last one?
About rebalancing as different
Oh,
communities
and
grow at
then
different
that's
speeds.
really what we
Right.
do, and if you, in our intermunicipal agreement,
Right?
we look at the percent for each community every 3 years. It's
Every 3 years.
updated every 3 years.
Okay.
And then, once we do that, if there's big changes in that, we kind of
Transition it.
transition it over a couple of years too. So
Okay.
like if Dousman or Ottawa or somebody goes from 5.9 and now suddenly they're 7.8 or something.
Okay.
We kind of transition that over a couple of years and then every year, every third year, redo it again.
So as the tax base potentially increase in certain areas significantly, the dollar amount could come down and get rebalanced?
Yep,
On a
and
per
it
home
does.
basis?
Yep. So
Okay.
if the city of Oconomowoc growing really fast and
Right.
adding more in, then it rebalances it, so the city of Oconomowoc share changes as
Okay.
well.
Thanks for your explanation.
Thank you. Good question.
Real quick follow-up on that?
Yeah, not just residents though either, right? I mean, commercial as well.
All
So,
of the tax base.
like the city of Oconomowoc has a lot, like you mentioned, ma'am, a lot more commercial base. So, and more calls because of that. So we're, as we grow bigger, we're gonna take a bigger percentage of that over time.
Real quick to that, because I've had a couple of residents give question in regards to TIF. So as TIF is applied to help incentivize specific growth, such as Olympia and what potentially is on docket for Rockwell, what's in place for Fall Lake Village, all of those, as those mature and close out, that tax base then is fully realized in the services and would be part of that rebalancing in the every 3 years?
Yeah, it sure is. I mean, the formula itself takes into account the whole city's value all the time. But when we put together our TIF districts, we always make sure that they close sooner than their legal life. And one of the reasons we do that is because that value comes into the city. It helps stabilize or, basically lower. Half of the value of a TIF district is there to lower your taxes. And the other half is to help catch up with services.
One quick follow-up, because both of those questions come up relatively often recently. I think the current tax base for that Rockwell project, for example, as it applies to the city, is around $8,000 a year.
Yep.
200.
After,
8,200.
Yep. And then after if that moves forward as proposed with a guarantee in place at a little over $32 million, the tax base as it applies to the city is over $100,000.
About 150,000.
The city's portion is 8,200 now. If that goes forward with council, it's roughly $150,000. That
would be-
equalizes out to help soften the blow to the tax base.
Yep. So I don't think the average person doesn't get into that, and this is a great opportunity to help clarify that as a benefit for those programs, because without those programs, the increase in the property value probably wouldn't be to that extent.
That's the purpose of the TIF program, is to grow that tax base where it wouldn't otherwise grow to that extent.
Thank you.
I don't have any other cards or,
Oh, this guy had a card, but he needed to keep his card because he had his notes.
sure, come on up. Thank you.
Hi, I'm Brian Fiesler. I recently retired after 42 years from working in the corporate world, so I've been in business a long time. Basically, I guess a couple of thoughts and comments here. One is that in our world, when we needed more money, we just didn't go out and raise prices on things to our customers because our customers could go elsewhere and find similar products. Now, in this case, obviously, you're in a different situation than that, but I think it bears consideration to look at areas maybe above and beyond the wheel tax and this referendum as ways to accomplish what you're trying to achieve. I think we all agree that we would like to know that if we dropped on the floor right now that somebody's going to be there. So I don't think there's any doubt. And we thank you for what you do, by the way, every day. Most of us really appreciate that. Probably everybody that's here, I would guess. So my thought is, you've stirred my mind in this area of the nonprofits and, or whatever you call them, the errands, the Towner Crests, the Shore Havens, the Three Pillars, and so forth. And if they are, because of the Medicare, Medicaid restrictions that are imposed upon you, not being able to fulfill what they really should be ponying up to do, then I truly believe that the area that we ought to be looking for first is the area where the services are being used the most first, and resolving that first. And if you did that, I took some notes, and if I heard you correctly, that pie chart was about $7 million, I think, 4 of it coming approximately from taxes, and so on and so forth. But if you short up the, I believe, $3 million that I heard somebody say was being a shortfall because of how you're being treated by the government, federal government, then we wouldn't probably be standing here having the same conversation, or it'd be a much softer conversation to have around your referendum to have a smaller tax amount that's being proposed. So my proposal is that you go look first at the area that's the problem, that's also driving the most need for services. And my second thought on that is, in those same regards, those facilities that are proposed to come into the community, whether it's Evan, whether it's Olympia Fields, whether it's what's happening west of the YMCA, Why isn't there some form of, knowing that they are the ones that are going to put the additional strain on the services that we already are all using? What is done, and maybe this is something that you were talking about that I don't fully understand, but what is done to make those developers pay upfront so that they contribute the fire truck?
I
They
can, I
do the
can,
this,
I
they
can
do
help you
that.
with that.
Please.
That's currently being done.
Okay.
And so, and then you also, when you look at retirement facilities, you have to know, are they nonprofit or for-profit? So for example, some of these in the city of Oconomowoc are for-profit, and they're paying the taxes for it. The nonprofits are not legally bound to have to pay us anything.
Okay.
That's state law.
That's the state law. That's our challenge. We have been working with the Shore Havens. We've been working with the other places, the hospitals, all of those. So those are things that we have worked really, really hard. But we are doing the best to try to get the most that we can. And Laura, you can comment a little bit more on that and what we're doing if you'd like. But your approach is 100% spot on. The question you have to answer is, do you want to go after all nonprofits? Because it affects all nonprofits that are there. Historically, churches don't pay. And that's not something that we have pursued. I'll be very clear, the city has not pursued having churches kick in extra money. But the other nonprofits, we have aggressively had discussions. Most of them have been very open and willing. They're just trying to make it be the least amount for them, and we want a lot more from them. So those things should hopefully help, but a lot of those things go into next year's budget cycle because when somebody comes in, for example, like Town or Crest, like you said, that was negotiated before it was built. And so those things were in the queue, and the city does do that. The other one that's currently is Journey 21 that's coming in. There's going to be a small component of that development that is going to be a nonprofit enrichment center. They have also offered, yes, they're going to pay a pilot program as well. So I wish there was a better way to get more money. And we're doing our best to try to get the most because it affects all the taxpayers. And it's the same thing that's happening in Dousman. And I feel for you folks. I get it. But I have to say, we still have our struggles here in the city trying to get enough revenue there to try to offset some of this.
Can I add something to that, Mayor?
Sure.
So Brian, what they're talking about is, in what's been mentioned is this pilot, which is the payment in lieu of taxes. And like the mayor said, we cannot require, if there's an area that somebody wants to move in that's zoned, and they can put in an old folks home there, and it happens to be nonprofit, we can't deny that. When Town or Crest came in, they voluntarily said, we're gonna pay our fair share of assessed city value. So they did that. One of the things you mentioned was Evan's actually taxed.
Correct.
But some things that some people don't know is the hospitals. So hospitals are nonprofit. So we ship a lot of patients to the hospitals, and the hospitals pay a pilot that's not necessarily in line. Their pilot's not in line with what their fair assessed value would be. So if I had a $150 million building in the city of Oconomowoc, my taxes would be much higher than what they're paying. That's the same problem that Dousman is dealing with, and that's the same problem that our mayor and our city councils continue to work with our nonprofits to address. We can't force them to do it. Some have voluntarily agreed to do it. They could actually just, other than agreements to do it, they could just stop paying them. And we have to continue to provide them service.
Yeah.
And there's nothing we can do about the Medicare write-offs.
Right.
We can't stop picking those folks up. So that's where our constraint is coming in. And it's significant. And like the mayor said, 2 churches don't pay taxes either.
Real,
But when you
So
go,
when Town or Crest, like $22 million says, hey, we want to build this in the city of Oconomowoc,
Mhm.
and you have to give them a approval to do that, right? A building permit, let's say.
Correct.
If you will. Upfront, you can't
we did.
stipulate before the nonprofit is actually up in business?
Depends how it's zoned.
Well,
So Town of Crest was not originally zoned as institutional.
It
There are
wasn't
other
part of the
areas
city.
where it's institutional, and they could just build.
yeah, so
Right.
with Town or Crest, that particular property was in the town of Oconomowoc and it was annexed into the city. The pilot program was agreed to as part of that process. And pilot programs can be participated because it is voluntary at either full tax rate or a portion thereof. And Town of Crest agreed to pay the full city assessed portion of the tax. Some pilot agreements could be half, could be, you know, here's a buck. So you have to understand the structure of the pilot that the nonprofit engages in. And the other part of those equations that I think is really important to understand is the difference between what comes out of the levy with tax and what can be associated with fees. And we did that recently with the
Public fire protection.
the fire protection, which used to be taken out of the levy, and then was, when we went for a rate case for water, ended up as a line item in your water bill. With that move, it moved it into those hospitals and other nonprofits paying their fair share for that part of the service, because it was a fee as opposed to a tax. So that was $800,000 that used to come out of the levy that is now associated with a fee and spread out to everyone that owns property in the city, regardless of their tax status.
Well, I don't want to.
I think the city of Oconomowoc does a really good job with the pilots that we have.
Yeah.
I think especially for any new construction coming in, I'm going to use my back in the day when some of these other ones were built. That wasn't as high of a concern as it is these days, but I can tell you that we are meeting with the other entities that, I mean, they do pay pilots here. And we are basically talking to them and saying, we are right now asking our citizens to double what they pay for the fire department. And so we are asking them to take a look at their budget and do the same as well.
Yeah, it just feels like, you know, the developers that are putting the pressure on the city and the services, as well as the not to pick on the not-for-profits, but where those services pressures are coming from.
But I would say that
That it's going to happen and, you know, based on saying yes to it coming in. So, you know, it's kind of like the cows are already out of the barn now. You've already let them all in, you know, and now we're trying to face this, but I assume that we're not going to keep repeating ourselves in how we go about doing that, and maybe that's what this,
correct.
you know, TIF, as you call it, I think, right, is.
I wanted the growth, the residential growth, whether it's the apartment buildings or new neighborhoods. Yes, they're putting pressure on but it's 7% population growth and 70% growth in calls, round numbers, and so it's a structural issue. And so the 7% of growth of residential and those developments, the taxes they're paying more than offset what they consume. So they're actually, if you think about, there's a new development of 200 family homes, and mostly young families, new homes, probably going to be very low consumers of fire and rescue needs. But they're going to pay a lot of taxes on those new homes. So they're going to be a funding source for fire and rescue, not consuming much until that population starts to age in that neighborhood. So of course they should pay their fair share, but I think in the short run, those developments more than pay their fair share once they're up and on the tax rolls. They're a big contributor, and without them, we would be decreasing services every year to increase, because we'd be paying the additional 3% wage increases and costs go up. So without that kind of development, it actually puts us in a worse spot than if we didn't have that kind of growth.
Yeah. Well,
Actually, I just want a quick touch on the pilots too, and that's been another benefit of the consolidations, is now the communities are sharing information and working together. And, you know, before Dousman was alone and they would have to work on those pilots alone, and Summit was alone, or the town of Oconomowoc. Now the municipal boards are able to talk and communicate as a group of, hey, how are we working with different nonprofits and our budgets and all of that. That's been a positive of working together.
You know, for Town Crest, I can speak personally because my mom lives there, right? And so I know the numbers over there. And I also know that basically every day that I ever go to visit, there's one of you guys are there, you know? And it's like the burden on your system has to be huge from that, whether it's a burst frozen pipe or, you know, whatever it might be. But, you know, people like my mom pay over $2,000 a month to live in independent living, and then you go 5,000 when you go to the next level, and you go 10,000 to the level after that. And I just don't know how these places that are bringing in those kinds of revenues that are nonprofit or whatever the word is, can sidestep their responsibilities when their pressure is so high that comes from those types of operations. So, you know, be glad to be on some sort of a committee or just be a sounding board or talk with you guys more, only because I have kind of a inside knowledge over there, I guess, as well. But the only other thing I was going to do is just real quickly math in public with you. You know, you said 62% of respondents, and maybe it goes back to the lady's question from Dousman earlier as well, but it said in your notes that were up on the site that there were 17,000 surveys that went out and 3,000 responses, which is 17% approximately. And it said 62%, you know, you're kind of misleading in what you stated in your news release, that 62% of the people, you know, approve taxes or whatever for this. Well, it's 62% of the 17% that actually responded that are saying yes. You know, you have 14,000 people that didn't say anything, which I don't want you to get, you know, kind of thinking that this thing is a done deal, because if you have that many unknowns out there, how can you possibly be sure of what is going to happen when the referendums go out?
Real quick.
Oh.
You had her hand up.
Oh, I'm sorry.
That's all right. Just kind of touch on what you just said, and I mean, you're right, the math is correct there. This last Saturday, two of the aldermen, or myself, another alderman, and the chief were at the farmer's market. And we talked to a lot of people, especially a lot of young families, that knew nothing about the referendum. They did not fill out the survey. They don't read the paper. I mean, it was first time they were learning about it, and they were very in favor of it. The feedback we got on Saturday was absolutely incredible. So yeah, you're right, that is just a small sampling. And, you know, you could argue Saturday at the farmer's market was a small sampling, but it seems like every time we get in front of people and get a chance to talk to them about it, it's very positive.
Yeah, I don't think anybody disagrees with the need for it. Not quite so sure how we got so far behind the 8 ball to have to catch up so much so fast, but, you know, that's another discussion for another day. But I just wanted to, you know, mention those numbers. And the other thing too about your survey results was that over half of the people were age 65 and over. And so, you know, those are the same people we just got done talking about for the last 10 or 15 minutes that are putting the pressure on the services, that also happen to sit and open their mail and have nothing else maybe to do. And, you know, I was at my mom's and I got the mail out of her mailbox and here's a survey for her. And I'm like, well, okay, so everybody in Town Crest got one of those. And so I think it gave you some distorted data as well based on that. And so, you know, in this world of data and analytics, which I lived in a lot, you know, I'm just trying to help you kind of normalize what you did and, you know, maybe what the facts are that surround that. How many total calls are there in the,
6,500.
and how many of those are false?
The exact percentage that are falls,
Like you get waved off?
like
Like you
no
didn't?
transports?
Yeah, like.
No, I think
I'm
he
trying to
means-
look at
False, like,
lift?
it was
Like
like
false
someone
alarm-
accidentally
like a
called.
false alarm,
Yeah,
or
Yeah.
like,
yeah, we got.
5%, one of the medics that does our data, probably 5% end up being a no transport, meaning they don't go to the hospital.
okay, all right. And I guess, you know, you guys are obviously the transport side of it, which gets back to this whole Medicare thing, but I was thinking on the other side of it, these facilities that are producing the need to transport, Town Crest has a nurse, they have nurses. Are these facilities able to help in that regard in any way? If they can't contribute otherwise, can they contribute with their own medical staff or add to their own medical staffs to do the stabilization or the whatever that leads up to maybe the need for transport? Maybe you're still needed for the transport side, but maybe it takes the pressure off of your resources to not have to do the things leading up to it.
I know of one example, and it's a requirement actually now for specialty care centers that they have to have telemedicine, and this was even before COVID, where if somebody's got symptoms, they'll telemedicine with a physician or with a PA, so that not every single time somebody has to go to the hospital. And that was something that was initiated at the federal level, because obviously we're not alone in this staffing need and this increase in call volume. So the facilities have had to implement that. And actually that was something new for our team members of, oh, we're going here for a stroke. Well, why'd you wait 30 minutes? And it was because they had the telemedicine side of it. So that is something that is happening here within our community with our various locations.
Okay, so you're saying that like in the assisted living side of things,
Yep.
they will actually do telemedicine to a doctor on call for
Or a
that-
PA or
or a
whoever's,
PA
yep.
For those, okay. All right, good.
The other thing to that point, I think you started to see, and I think you will continue to see, more seniors aging within their home and looking for in-home care. And that's probably going to be a hardline trend for comfort. I'm gonna be in my home as I do this. I'm gonna have somebody come in and help with that care. So, and the overall fact is we have an aging population in Waukesha County. So those numbers are going to continue to go up, right? So as we continue to grow in that population of 65 or 55 and older, you'll see more calls, and that burden spread out a little bit more from the traditional senior living centers to down the street, you know, the residential homes as well. So it's just part of that equation. The other thing that I think is maybe kind of important, because you touched on the growth factor of the community. Out of the 7% of the overall Western Lakes Fire District growth, I think the city is very vibrant. Ease of numbers, and Lori, maybe you can help me a little bit. If our tax base, our levy is $10 million, for example, that we collect, and we have 0% growth next year, our tax levy is still $10 million. So we can only raise that tax levy by a percentage of what the growth of the community is. That is what helps us to kind of offset the inflationary pressures and other costs of goods. A little bit, right? So that's reflected in the assessments and the mill rates. So now you see, last year was the first of 5 years where we have year-to-year assessments. You saw the mill rate go down. You'll see the mill rate probably go down again.
Well, this year, yeah.
Because that it's a dollar amount collected, not the and fluctuation of the mill rate. So just because we grew doesn't mean that we're flush with cash
It
necessarily.
doesn't mean that we collect more money. It means that the amount of money that we
Spread
spend
out.
each year is spread out over more people.
Right.
Yeah, well, I want to just, that was going to be one of my last comments too, to touch on kind of like what you just said, but just because if you were to get this approved and you got the money, doesn't mean that they will come, right? It doesn't mean that you're going to get the people, right? It doesn't mean that you're going to get that we're going to get any better services. So how, it's kind of that chicken and the egg thing. It's like, well, you know, show us the people and then we'll show you the money, as opposed to the other way around, because otherwise we send in our taxes and we still can't, you know, have any services because nobody got hired, because nobody wants to do the job, to do any work.
I can touch on that. Is every year we lose about 40 employees a year. We lose about 25% of our workforce for higher paying jobs or full-time employment. So the majority of our workforce is part-time or paid on call. And it's almost weekly. We have an employee say, I just got a full-time job, I'm leaving. And these are part-time employees that are picking up 48, 60 hours a week. And even our full-time employees are leaving to go right down the road to other fire departments to start making on day one, $10,000 to $15,000 more than they're making here. And they're leaving because they're burnt out, because the number of people we have working a shift is that 2 or 3 compared to our neighbors that have a 5-person crew at the station. So they're spreading that workload out with 2 extra bodies. So we have seen the numbers. We lose really, really good people that want to keep serving here, that grew up here. But we didn't have the funding to retain them, so they have left us.
So part of it's retention more than it is necessarily growth, I guess.
Yeah.
Correct.
But great question.
Well, thanks for hearing me out.
One final thing in regards to that, I think that's noteworthy is the number of people that the Western Lakes Fire District is looking to bring in that full-time position, 38, correct?
Yep.
Isn't an increase in the overall staffing. It's a conversion of the paid on call into a more reliable staffing model that you know they're gonna be there when you need them, right? So you're not looking to go from again, use the number, 180 members of Western Lakes Fire District to 220. You're looking to maintain that number of 180, but convert upward the reliability of that staffing model into the full-time career path professional.
Well, and we'll still have volunteer and paid on call. too.
Yeah,
To
yeah, so
supplement.
the number will still go up. It's still gonna be additional staff because we wanna retain our part-timers. And that's why a big component of this also is improved wages for our part-time employees to bring them at least to what Taco Bell's paying or our neighbors are paying and, where we're seeing people leave to go to. So there will be additional positions, but there's no additional capital costs for, new equipment or another fire truck. We've got the equipment. We don't have the bodies, and this is filling that gap. And the other key part that the task force worked on is sustainability with the new growth. We have the master plans of each of the municipalities. So we know what that new growth is looking like 3 years, 5 years from now, as long as, it happens. And that was all part of this plan, because we didn't want to come back and say, here's another big increase. This was meant to have us work within the normal levy and the normal means moving forward.
I guess the last thing I would just say is, as a former business guy, is that, there's one pot of money to work with when you're in the corporate world, and you got to decide where you're going to add and subtract and shift things around. And I guess, when I look at the pie chart for the tax bills that we each get, maybe some other areas need to change. And
100% agree with you on that.
Yep.
Right? I
100%
mean,
agree.
that's got to be really scrubbed. And man, I tell you what, we would be doing that in the business world, and I would expect the same if you're managing our personal money.
If I
So,
can,
I
to
would be
comment to
glad-
that, Brian, that's an excellent point. It's something I've stressed for 8 years on this board. We're doing the referendum, and the number is what the number is. But if we're able to get our operational budget in the city lower on all of our other departments and scrub, we can actually reduce the amount of referendum per household. But that will take this board to do that, and that will take citizen engagement. So come back in October when we're doing our budget and encourage us to make some of those changes. We have a lot of departments, and we have a lot of overhead, and we have a lot of personnel in other departments, and we can make small adjustments to our budget to offset. So instead of $80 per 100,000, maybe it could be 75, or it could be 72. But that takes courage from this board, and the only way for a board like this to have the courage is for people to come out and say what you're saying.
Yeah, well, and I live in the town, so, I'm not in the city. So, sorry, but I feel like
And
I've
we
earned
spent too much time with you already.
the town meeting, so I wanted to be able to share with some of you at least. But I would be glad to be a part of some eyes to scrub some things, or to at least question it, because I have kind of that ability based on the business that I worked in. So would be glad to do that. But I just think you got to do a Pareto analysis. You got to look at two things. You got to look at where are all the services being demanded, and where's the big chunk of the money that we send in every year going to right now, and does it really all need to be used for that, or do we move it around? And, if, to your point, people are going to be staying home for telemedicine and all that as they get older, well, guess what? There probably aren't as many kids that are going to be sitting in classrooms either. So do we need to build big brick and mortar when nobody's going to be in them? So,
And I think, Brian, the other component of this is just one part of the pie. This is just fire.
I know.
We have 10 departments, we have multiple growths, so all that growth and the increase in costs have to be distributed not just with the fire, but with everybody. And so that's what we're trying really hard to do, but I think all your comments are well received. I'm happy to talk to you a little bit more about that in depth, because I love your approach. But taking your approach and turning it into reality with the outcomes we all want as you've heard, is a challenge. But I can tell you, at least you should move to the city of Oconomowoc because we do that.
Make me a
We
deal.
work hard on that.
Make me a deal.
Again, I got one more thing to, hopefully people watch this who aren't here, and reference it. If this referendum passes, it shows up as a line item on the tax bill, is that correct, Lori?
1 year.
For 1 year. So, but you will actually, right now, if you looked at your tax bill, there's no line item associated with fire, there's no line item associated with PD. This referendum passes, you'll see what is allocated specifically to the labor associated with fire for that first
For 1
year.
year. Then it gets rolled into your regular tax numbers.
And by the way, we just got our appraisal for a 25% increase on our valuation. So, you know, it's that in addition to the little percentage that's on the chart up there, right?
Yeah.
So the assessment is applied to the mill rate.
As the whole
Right.
community's assessments go up, it lowers the mill rate.
Right.
So this number will be different based on what the community's new up was. So if the community as a whole went up 25%, this impact, if that was the whole community, will drop 25% because the community's value went up. So just because it went up 25% doesn't mean your community can increase taxes 25%.
Right.
So, all right, we've got Sarah Havey.
So we've kind of addressed my question, that's why I added the second part to specify a little more, is so, first of all, I love how you wrote out the formula, but I love the math too, so like if in future we could have the literal formula, so like you could input data, I think that might make it clear for some more people, which that's a complaint I have at all levels of government, not just you, but actual numbers are great with formulas, because I teach math, I like to be practical with it. But so my question is, we've talked about like those commercial and those nonprofit things and how some of them have been factored in from the get-go and have paid that right away, others haven't. Where in that formula does that stuff fall that we can't account for? And where in that formula does additional funding of like, oh, I'm just gonna go to the pancake breakfast and donate $500, where does that sort of funding fall into this formula?
Sure. Do you want to answer the?
Start the pancake.
All right, I'll start. So, for example, our pancake
Good
breakfast. Our pancake breakfasts, or last year we did the Bands at the Beach event, and those were on groups and various nonprofits that help sponsor those. So Western Lakes Fire and EMS Association, which is the nonprofit 501c3 of the membership, and everybody volunteers their time to come to those pancake breakfasts or special events. So our employees are not on payroll during those events. If it was not being ran, so if it was being ran by the fire district and not the nonprofit side, we would have to pay our employees. And we would actually be at a net negative. So those are our open houses, our ability to open up and see our community, see our residents. And if we raise $5,000, that's all through the 501c3. That's not part of our general budget. It's separate. And that's how we were able to purchase the new drone. We had a variety of donations through the Bands at the Beach and our pancake breakfast that year that without any taxpayer money, the drone was able to be purchased. And in light of what happened in Highland Park, now that drone's going to be used for all of our parades to be able to look at rooftops. I never thought I'd say that, but we've used it to find missing people, elderly, autistic kids, car accidents, water rescues. So that's what the pancake breakfasts provide. Other things that the association, which is the membership, they're all volunteering their time as part of that. They bought new workout equipment for the stations, new treadmills, with their money that they raised through the pancake breakfasts or other events. That didn't come out of the taxpayer budget, and that's why it's not shown as part of our budget. So good question.
Okay, thank you for that clarification. It's very similar to then like my classroom budget as a teacher. Like I've got that additional PTO fund that I use to like buy cool prizes versus my books that I actually need. Thank you, that helps a lot.
Yep. Do you want to touch?
And most of those fundraisers are usually for one-time costs or expenditures. They're not for ongoing costs, which is what labor is, as you know.
Yeah.
You want to talk a little bit more about
Are you in the
nonprofits?
city? Do you live in the city? Okay.
So real quick to that point too, that the mayor made, and that I think somebody else mentioned in regards to the developers coming in. Impact fees associated with what developers pay go to help offset capital cost, not ongoing operational cost. And I think that's something really important to remember as people may be talking about that. Well, how come you don't penalize or receive additional dollars from a developer for more firefighters or more cops? Well, those are operational costs. Capital costs have been recouped in those impact fees to help offset things like the municipal, the public safety building and things of that nature. So those capital costs do get spread out to the development and developers as the city grows.
So the formula is specifically for these ongoing labor costs. That's what's factored into the referendum. It's not the capital cost of like building the fire station. We already have those and we have our taxes from those commercial things. This referendum is addressing specifically that labor portion, if I'm understanding correctly.
It's operation costs,
Okay.
yeah.
All labor.
Okay.
Yep.
Great. I think that answers my question. And then just an additional thank you. The fire department is literally my neighbor, and the little screaming munchkin out in the hallway was born at home by very close to those neighbors. And when I told my parents, who are thousands miles away, that, my dad was like, yeah, you baked cookies for the EMTs, right? So if something goes wrong, they're right there. And I'm like, don't worry, Dad, they're right there. So thank you guys for all that you do and for making us as a growing young family who didn't fill out the survey because it got lost in the mail feel very safe in this community. Thank you.
Thank you. Do I have any other comments or questions from citizens? No? All right, well, I guess just on behalf of myself and the members of the fire district, thank you all for taking time to be here tonight. I know time's valuable. Thank you to all of the team members. I know I'm the one sitting up here answering the questions, but we couldn't do the things we do without the employees of Western Lakes Fire District. Whether they're full-time, they're paid on call, they're interns, they're part-time, we need everybody. And we are a family, and we work hard to serve, and we're proud to serve, and it's hard to say that we need help, but we need help. And we've been trying to hold it together for years, and thank you for being here to learn more and ask your questions, because that's what this is all about. So thank you from my behalf.
And thank you, Chief Bowen. This concludes tonight's informational session. I think at the end of the day, we all want to make sure that our public safety folks are there and they're there as fast as possible. And I want to thank everybody here that's shown an interest, and hopefully those folks that are going to view this either live right now or hopefully in the near future. It's really important that we have an informed voting community in all the municipalities. And if you have any further questions, if you have the information and the facts, I think you can make a really good informed decision. Please reach out directly to Chief Bowen. You can reach out to any of your aldermen, to myself. The main thing is that you understand exactly what this entails and why that this has been brought towards you. So again, council members, thank you so much. Mr. Shaw, our board representative, thank you. Our interim city administrator,